activity, exercise, keeping fit. Most people don't do it. It's probably the most important part of your health. And we're going to look at some of these things. So Jerry and team has put together some really information. So my plea to people is that the last 2 years of your life often is spent with suffering and may go to a nursing home. And the best way to prevent that is to be active. And the day you stop walking, moving well, unfortunately, the clock is ticking for bad things such as the nursing home. And so please, please, please incorporate activity for your brain health, your mental health, for all sorts of benefits. And we're going to learn about this. So Jerry, take it away.
Hey, Dr. Curnew. So today we're going to talk a little bit about exercise tracking, so why we should track our physical activity, and then we're also going to talk about the FITT principles. So this is something we use kind of to be able to track our physical activity throughout the week, throughout the month, etc. So first, I'm going to talk about kind of what to expect today. So we're going to talk a little bit about the guidelines first, Canada, and what they mean for you as a patient. As well, we'll go into each of the letters of the FITT principles. So frequency, intensity, time, and type, talking a little bit more information about it and what things you can pull from those 4 words. And lastly, we'll talk a little bit about self-monitoring. So some tips to get started with monitoring your physical activity. So I'll pass it off to Daniela to talk a little bit about the guidelines in Canada.
Hi, so we're first going to start again talking about the exercise guidelines in Canada as per the Canadian Society for Exercise Physiology. So these guidelines focus more on what a healthy 24 hours looks like for Canadian adults. So they don't just focus on the single movement of exercise, they kind of integrate all aspects that are important to health. So first, we're going to be talking about adults, or the guidelines geared towards adults aged 18 to 64. So there are 3 main areas that we're going to be talking about. And the first being physical activity, and to be physically active every day. So performing a variety of types and intensities of physical activity, focusing on moderate to vigorous physical activities, approximately 150 minutes a week is what you should be aiming for. Another important aspect is to be integrating muscle strengthening activities using major muscle groups at least 2 times a week. And you want to kind of integrate several hours of light physical activities. Throughout the day, making us not want to exercise or really exert any of that energy that we don't really have. So getting 7 to 9 hours of good quality sleep on a regular basis is very important, and you want to make sure you have consistent bed and wake up times. So going to bed at the same time every day and waking up around the same time every day as well. Also, we want to minimize our sedentary behavior. So sitting still or not moving around. So we want to limit that sedentary time to around 8 hours or less, and trying to have no more than 3 hours of recreational screen time. So on your phone, on your laptop, TVs, anything that has a screen, you want to try and limit that to around 3 hours, and breaking up long periods of sitting as often as possible. So as I mentioned before, say you're watching TV, there's a commercial break, you could do a couple laps around the kitchen or just have a little bit of a standing break.
Well, let's actually pause for a second over here. So you're saying activity, sleep, less time doing, not moving. Now, first of all, if you look at most older people, they don't get 7 to 9 hours of sleep a day. When you're quite young, and Dr. Galchuk did a really nice webinar. Everybody should go back and take a look at that way back when. And some of us need a few hours of sleep. Some people need a lot more hours. So my plea to everybody is figure out what your sleeping habits should be. Your sleep gets more fragmented as time goes on. I don't get 7 to 9 hours, and I do pretty darn well without that. And am I sleep deprived? Yes. Am I sleeping better? Yeah, after that webinar, I have better quality sleep. And there's some things in sleep hygiene that's really important. So just because you don't get those magic 79 hours, doesn't mean you can't get good quality sleep. Issues about, TV time. Yeah, couch time. And I think that's really a big problem for most of us. I heard some numbers, and Danielle, can you tell me, is that the average North American is spending about 5 hours a day on things like watching TV? Is that still right?
It didn't mention on this website, or I believe it was the Government of Health website that I was on. It didn't mention a 5 for anything. So I'm not sure if that's
Okay.
still.
I think a lot of us, I think TV or now with screen times and just doing nothing is that it's important. So I'll tell you, after you have something to eat, get up and walk around. That improves your insulin resistance. It helps things. If anybody sees me in the clinic, every time I see a patient, I get up, walk around to the front desk, things of nature. That's done purposely to create movement. Because it's easy not to. And this 150 minutes of March physical activity, that's not enough for us. I think we should do more, you see. And Jerry keeps reminding me I need to do more resistance training, and it's something I have to work on. So I try to practice what I preach. I'm not perfect, but I'm getting better. So I got better quality sleep. I'm definitely spending less time of sedentary time now. I can guarantee better sleep time every night. Make it a habit is that go to a quiet place, no coffee after about 5 o'clock, and put on one of our webinars. Look at me in the face, and you will fall asleep in 15 minutes and sleep well for the rest of the night. So create that habit about that. I encourage everybody to spend like 5 minutes every night with sleep time. The other thing is that I'm also learning when you get up in the morning. My biggest mistake is that I go right to my computer. It's nice outside. I should go get some little bit of vitamin D, move around. So I should start the day walking. And I have to get back with my wife and doing this. At one time is that my wife doesn't sleep well, and we used to go for walks, but she has trouble falling asleep. And so I'm afraid to wake up in the morning. So I need to get out and get there for walking first time of the day, or go for a bike ride, or do something. So then you taught me is that the first thing in the morning, I'm going to change my habit. I'm going to get outside the first thing and go for some sort of activity outside, provided it's not pouring rain. I've already tried to work on my sleep, and I actually fall asleep with my computer on, learning about health and things of that nature as well. So I'm going to encourage everybody to do that. And I'm really lucky. I have a lot of people to play squash, go bike riding, and things of that nature. So find your entourage to make that work better. So these are 3 real pillars here, and thank you for bringing them. And you can decide, how much of what you want to do. And some of us are good sleepers, some of us are better exercises. I bet most of us are good couch potatoes, and we gotta learn how to deal better with that. And because this is important. This is maybe the most important things you can do as you get older. It determines how long you're going to have your independence left. I'll repeat that. This determines how long you're going to be independent. Because once you lose your ability, I'm too sore, I'm too tired, I'm too short of breaths, your quality of life goes down. And for many people, the nursing home is close by. You get pneumonia, you get sick, you fall, break your hip, you fall, you don't have enough reserve to bounce back. So I still have to work on my resistance, and I have to learn my flexibility. My wife says to me, look, if I don't work on this, I'm going to fall, hurt myself one day. And she worries I won't have enough resilience to fight back on that. So I'm going to work on some of those things. I don't expect perfection, just hard work. Take it away.
Yeah, no, you made some awesome points. The guidelines for adults age 65 plus are very similar, if not the same. The one thing that is added though in the physical activity section is challenging your balance. So physical activities that challenge balance could be, getting up from a chair with no hands, trying to balance on 2 feet with no support, or if you're feeling really ambitious, trying to balance on 1 foot with no support. So those could really challenge your balance in a very simple way, as well as integrating that normal physical activity of around 150 minutes or more a week. the muscle strengthening, as well as working on getting more sleep and reducing that sedentary behavior. So why should we meet these guidelines, or why are they relevant, or what does this help? So these benefits, or the benefits of following these guidelines, far exceed any potential harms. So they may be challenging, and you might find it a little difficult to become consistent with these things, but they will result in some great health outcomes. And all types of movement matter. So replacing that sedentary behavior with physical activity, it could be gardening, it could be going on a small walk, a long walk, whatever is most convenient for you. All type of movement is good movement. So one of the major things is weight management. So eating patterns and physical activity go hand in hand with weight loss and weight management. So you gain weight when you consume more calories through eating and drinking than the amount of calories that you burn, including those burned during physical activity. So adding some physical activity into your daily life in conjunction with eating a better and cleaner diet can help you to manage and maintain your weight. Also, we reduce health risks with physical activity. So adults following these guidelines, according to the Canadian Society of Exercise Physiology, lower the risk of cardiovascular disease, type 2 diabetes, several cancers, and improve their bone health. So regular physical activity can lower your blood pressure and improve your cholesterol levels, aiding in the reduction of the risk of cardiovascular disease. Also, as Dr. Curnew mentioned, there's a bunch of psychological health benefits. So specific to psychological health, participating in these optimal levels of physical activity can be linked to improvements in anxiety, depression, dementia, cognition, and improve your overall quality of life. So, for example, exercise causes our body to release chemicals such as endorphins and serotonin that improve your mood, cognition, and concentration. And if done with other people, such as a spouse, a friend, a neighbor, they can reduce the feelings of loneliness and isolation. And lastly, but this list is not exhaustive, there's many more benefits. It can reduce your risk of falls. So physical activity improves your physical functioning, such as climbing stairs, playing with your children, your grandchildren, and it decreases the risks of falls and fall-related injuries. So people who integrate physical activity into their daily lives, such as aerobic exercise, like walking or water aerobics, muscle strengthening, and balance training, they have fewer functional limitations. So they can do more than someone who maybe doesn't integrate these things into their lives. And what's great is that so much of this exercise can be done at home or even in a community setting, but it can be done in the convenience of your own home. So I'll let Jerry take it away for the next section, and yeah.
All right, so now we're going to be discussing one way to quantify your physical activity, which is exercise frequency. And exercise frequency refers to how often you exercise in a given period of time, and typically that's measured in weeks. So for example, your exercise frequency might be 2, 3, or 4 times a week. And there's no standard for what your exercise frequency should be. And it actually varies for each individual based on a number of factors like age or fitness level. So for example, the American College of Sports Medicine suggests that beginners should exercise for 2 to 3 days per week. And another factor you should consider is your health. And there's obviously different guidelines based on different health conditions like diabetes or hypertension, which we'll get into later in this presentation. And then finally, exercise frequency is also dependent on the types of exercise you choose to do. So for example, when you do strength training like lifting weights, your muscles can sometimes take 24 to 48 hours to recover. And in that case, you might want to spread your exercise out more to give your muscles enough time to recover between the sessions. So next slide, please. So what are the recommended exercise frequency levels? Let's take another look at the guidelines and focus specifically on the exercise frequency. So the recommendations for children include 60 minutes or more of physical activity 7 days a week and strength training 3 days a week. And then for adults aged 18 to 64, they're recommended to do at least 150 minutes of moderate intensity activity like brisk walking. And you might be wondering how frequently you should walk to get those 150 minutes in per week. And it's actually recommended that aerobic physical activity be spread throughout the week. because research studies show that activities performed at least 3 days a week produce health benefits like reducing the risk of injury and preventing excessive fatigue. And then adults are also recommended to do activities that strengthen muscles 2 days a week as well. And then the recommendations for older adults aged over 65 years are the same, with the addition of doing the activities that improve balance, like standing on one foot. And that's also should be done 3 days a week. Next slide, please. So now we're going to discuss exercise frequency for those with diabetes. And the American Diabetes Association recommends that patients exercise daily, or at least not allow more than 2 days to pass between the exercise sessions in order to enhance insulin action. Now, what are the benefits of this? So it turns out that aerobic exercise increases muscle glucose uptake by 5 times through insulin-independent mechanisms for up to 2 hours after. And these refer to mechanisms that our body uses without the use of insulin. And then it can also increase muscle insulin uptake through insulin-dependent mechanisms. So those are the ones that do use insulin for up to 48 hours after. So that means that in order to keep your muscles in a constant state of increased glucose uptake, diabetes patients should try not to go more than 48 hours between their exercise sessions. And then another benefit of frequent exercise for diabetes patients is that regular aerobic training can actually increase muscle insulin sensitivity as well. Next slide. So now we'll be looking at exercise frequency and hypertension. So the American College of Sports Medicine recommends that hypertension patients engage in aerobic exercise on most, preferably all days of the week, and in dynamic resistance exercises on 2 to 3 days of the week. So individuals with hypertension are encouraged to engage in a higher frequency of aerobic exercise than those with normal blood pressure, because a single bout of aerobic exercise can result in immediate reductions of blood pressure by 5 to 7 millimeters per mercury, which lasts up to 24 hours after the session. So reductions of that amount in blood pressure actually translate to a 20 to 30% reduced risk for cardiovascular disease. And then also current research shows that dynamic resistance exercise may lower blood pressure to levels similar to that of aerobic exercise as well.
Thanks. Now we're going to discuss exercise intensity. So what is exercise intensity? Well, one definition is how much energy is actually expended when exercising, or in other words, it means how hard your body is actually working when you're exercising. Now, how do we actually measure exercise intensity? It can be a bit difficult, so there's 2 different ways you can measure it. First is a more objective way to measure it, which is looking at your heart rate. And what the general rule of thumb is, the higher the heart rate you have while you're exercising, the greater the intensity. So for instance, if you go on a 30-minute run versus a 30-minute walk, although both are great exercises to do, your heart rate would be much higher during the run than it would during the walk, meaning that running would be a more exercise, would have a higher exercise intensity. However, rather than just looking at heart rate, it's actually really important to consider how you feel when you're exercising. In general, exercise intensity is a pretty subjective experience with the exercise, maybe too, health conditions, and even your mood on a particular day. Because I know for me, if I'm not really feeling exercising, I'm not going to work as hard than when I feel really motivated to exercise. So my exercise intensity might be a bit lower when I'm just not in the mood to exercise. So let's think of another example here. I'll use a personal example myself. So both my brother and my dad love to swim. However, my dad is a 63-year-old with a heart condition who swims more for fun. And although he does swim competitively in some kind of instances, compared to my brother, who is a varsity swimmer and swam competitively for almost 5 days a week throughout his whole life, when they get in the pool and they do the same kind of routine, my brother probably isn't going to have the exercise routine isn't going to be as tense for him as it will be for my dad. And that's just comparing it. So although they might be participating in the exact same kind of routine in the pool, they're going to have different results and they're going to have different feelings outside of the exercise. And that's just something that we have to acknowledge and remember. So when we give you exercise routines, or when you find some on the internet, although it may not be as intense for some people, could be more intense for you, or vice versa. So that's something we really want to express to you, is that exercise intensity is really based on the individual and focuses on how you feel when completing the exercise, rather than just how someone else may actually feel. Now, when we're looking at exercise intensities, they're kind of different, there are different ways to measure it. So next slide, please. So one that is actually not listed on this slide here that I just want to discuss a little bit is low intensity, in which you are not really moving at such a high pace. So this may include things like light walking, or maybe doing little errands around the house, kind of just getting out and about. And this exercise is going to feel pretty easy for you, and your breathing will be relatively normal, but maybe a bit quicker than when you're just kind of sitting on the couch watching TV. And you'll be able to both sing and talk during this exercise, and you probably won't even start sweating at all. Or if so, it'll probably be after maybe 30 minutes to an hour of actually participating in the exercise. Now, the first one I want to discuss that's on the slide here is moderate exercise, in which it feels somewhat hard for you. And your breathing will begin to quicken a little bit more than that low intensity, and you begin to sweat after around 10 minutes or so. So when we say that your breathing quickens, this could mean that you're able to speak or talk with someone, but you won't really be able to sing along to your favorite songs. Next, we have vigorous exercise, also called high intensity exercise. And this is one in which we feel challenged. And with this, your breathing is pretty deep, it is rapid, and you won't really be able to say more than a few words without taking a pause in between or taking a breath. And you definitely won't be able to sing. So while you're working at this intensity, you'll probably end up sweating after a few minutes or so, because it's just that so high and intense for you. Now, lastly, something we want to mention is something called overexertion, or overexerting yourself. And this is something that we want to kind of be aware of and avoid doing so as often as we could. So in moderation, it can be pretty helpful to kind of push yourself beyond the limit. So let's say you are you're going from like 15 to 20 pounds. That might feel overexerting for a little bit, but then you'll get used to it. However, if you're continuously overexerting yourself, you are going to put your body under an immense amount of stress, which is something we want to avoid. So a good way to know if you are overexerting yourself and may want to step back or kind of go back to your previous exercise for a little bit before working your way up there is that if you feel very short of breath and you aren't able to complete the exercise for as long as you originally planned. And that may mean that your intensity might be a bit too high, and you may need to backtrack a bit before attempting this level again. So next slide, please. So now that we went over all these intensities.
You need to backtrack one slide. I think it's actually really quite important. I think you relied on some really good things. So people always say, how much can I exercise? And I like this idea of listening to your body, and you show different ways from singing, talking, shortness of breath. So just everybody reflect on this a little bit. Now, one of the things that my job is to make sure during that event, the blood supply. So that we often do a stress test, and we measure things in METs, and we can maybe come back to that a little bit later. How do you feel? I think most people, you mentioned your brother and your dad, and they actually make activity part of their life, and they understand that a little bit. But I think we need to really think about this. Am I overdoing things? The other thing that can happen is we can injure ourselves. And I'm in my early 60s now, and I don't try as hard as when I was in my 20s and 30s. And I hurt something. I don't want to pull something, number one. Number two is that extreme exertion can overdo things, and it can lead to heart attacks. So just to point out is that everybody can do a marathon, and you have to decide how long it's going to take you, whether 3 hours, 3 years, 3 weeks, whatever it is. People die at the end of the marathon when they have their cardiac arrest. So they give that extra push when they're exhausted. So learn to understand your body, and if you have any concerns, we can talk about that. And so I think that's really important, learning how your body feels, and also making sure if you really want to exercise vigorously, which I think is wonderful, my endorphin levels, and I feel the best when I'm outside and I'm sweating. I want to make sure it's safe to exercise, and I also want to make sure that I'm really able to push myself. So thank you for sharing that.
Yeah, thanks, Dr. Curnew. And to kind of add on your point there, I know, bringing back my dad as an example, he was training a lot for a few weeks for nationals to actually go compete with the swim team. And about 2 days before, we're moving my grandma into another apartment, and he actually injured his back, which I don't think probably if he wasn't overexerting himself swimming there. So I know he's in an immense amount of pain at the moment, which is not fun for him, but it's just something to kind of reflect on. And that if you are overexerting yourself during your exercising and you maybe aren't taking those steps back, just be a little bit more conscious in the exercises or kind of movements you're doing outside of exercising itself, because you don't want to get hurt, or you don't want your exercise to lead to you getting hurt, even just picking up a box or bending over to get something from the fridge, because that can also happen, which is something really important to acknowledge. So thanks to Curnew for that. But yeah, let's move on and kind of talk a little bit about the talk test. So as we mentioned, and Dr. Curnew mentioned, when we were talking about different intensities, we brought up the example of being able to sing or talk when we're actually doing them. So this is something that we like to call the talk test, which is simply just a way to measure exercise intensity. So in general, we say that when we're doing a low intensity exercise, it would be easy to talk and easy to sing. However, if we kind of move on to more moderate exercise intensity, it might be easy for you to talk, but difficult to sing. And if we go to that high or vigorous exercise intensity, it would be difficult to talk and both difficult to sing. So now I know when I'm exercising, I love to listen to music, specifically Taylor Swift's my favorite singer. So I always am listening to her. And a good way for me to test my own intensity is when I'm exercising, I'll try and sing along to one of her songs. And if I feel that I'm singing with ease, I might be like, okay, maybe I need to pick it up a bit. Maybe I need to put my treadmill on a little bit of a faster speed or a greater incline to just get my heart going a little bit and get my breathing going a little bit more, just to make it more difficult for me to sing there. But when we actually kind of think about what exercises fall under these intensities, we have a few examples for you listed here. So for low exercise intensity, we have things like slow walking, stretching, and light housework. And then for moderate exercise intensity, some examples could be some brisk walking, baseball, or leisurely swimming. And then for high exercise intensity, we have jogging, soccer, and dancing. Now, overall, again, we really want to emphasize to you that exercise intensity is subjective. So even if there's an exercise in one of these columns that don't fall under your specific personal columns in your life, so maybe for you, brisk walking might actually be a low exercise intensity, or maybe even high for you. It's really important to, again, listen to your body and find whatever exercise fits under your exercise intensity level. Just do that and try and work your way up into completing more of those higher exercise intensities. But again, listen to your body, don't get injured, and just don't push your body under immense stress. That's all for me.
Hi, so I'll be talking about time in terms of the FITT principles. So time refers to duration of each exercise. So as you've mentioned before, the CDC recommendation guideline states that you should get around 150 minutes of moderate intensity exercise a week for 30 minutes a day, or 75 minutes of high intensity exercise a week, 15 minutes a day. And again, we've talked about it broken down by age. And so if this is too much to remember, basically what you want to aim for is 20 minutes of continuous activity every day. And so though these are aims, it's important to slowly pace yourself and gradually increase the duration of your workouts and listen to your body. Next slide, please. So why is it important? Deciding the right amount of time to exercise and pacing is important for a couple of reasons, with the most important being motivation and injury prevention. So the motivation aspect kind of relates to goal setting. So we've talked about in a previous webinar about SMART planning. So this is making your goals specific, measurable, achievable, realistic, and timely. So if you set your expectations too high, you are more likely to experience burnout faster and become even more demotivated by the fact that you are not reaching your goals, or that your goals are unattainable. By starting small, let's say even 5 minutes a day, and gradually increasing the duration, you are more likely to sustain your healthy habits, gain more confidence, and experience less soreness from your workouts. So soreness is a huge deterrent for many people. They start off too strong and must rest for a long period of time to recover their bodies, which leads to further hesitation about exercising. So setting the right duration for workouts and gradually increasing the time can help prevent this soreness and also work towards injury prevention. So many people, especially of the older generation, abide by the mentality of the no pain mindset. And this can be harmful for both your physical and mental health. So the idea of pain is always good and you should push through the pain often can leave you worse off than you started. So to find the right duration for you, you can use a talk test as we've mentioned, and look for symptoms listed on the slides and your limit. Find yourself doing a certain workout and see how long it takes for you to get the following symptoms. Then adjust to a duration that you think you can maintain and continue to gradually increase until you've reached your goal. Next slide, please. So I'll be talking about the optimal time for diabetes. So as mentioned in many of our webinars, exercise is a great form of treatment for mitigating the effects of diabetes. So to briefly summarize its benefits again, exercise helps control weight, lower glucose levels, increase insulin sensitivity, and can lower your HbA1c levels by 0.7%. And as iterated in a Harvard Health article, 2 hours of walking a week can lead to lower risk of heart attack. 4 hours of moderate intensity exercise a week can lead to 40% reduction in heart disease. And specifically to type 2 diabetes, 30 minutes of walking a day can lead to 50% reduction in symptoms. So I've created a little flow chart for you on the right. So the recommended time for working out is 1 to 3 hours after eating. So this is when your blood sugar is at its peak. Before starting your workout, make sure you check your blood sugar and make sure that it is greater than 100 milligrams per deciliter. So if not, you can have a light snack and check again after 30 minutes until this level is reached. When you start your workout, you want to aim for low intensity exercises that can maintain longer durations. And this is because high intensity exercises can cause a spike in blood sugar, which can do more harm than good. So
Hold on for a sec over here. I'm hearing, oh, first of all, can someone look what 100 milligrams per deciliter is in our units? Maybe Haley and other people as well can look up, because milligrams per deciliter are US units. We use millimoles. Now, one of the things you're saying is you can lower your hemoglobin A1C by 0.7. That's almost as good as a medication to lower your blood sugar. And you can lower your risk of having a heart attack. You can lower your weight, less depression. In fact, exercise improves joint function, improves arthritis if you do it properly. So, this is a wonderful medication. I hate this word exercise. This is my feel good pill. This is my good, my vitamin D. People take vitamin D. I just go for the sun for a half an hour most days. This is really important, and so just think about this. You're going to take pills for diabetes. You're going to take pills for heart disease. You're going to take pills for dementia, pills for arthritis, and pills for depression, pills for blood pressure, pills for everything, and you less pills. If you add activity, and you'll feel better.
Yeah. Thank you, Dr. Curnew. Yeah, exercise is really a great tool. Just continuing on the flow chart, if you have,
instead of exercise, I'm going to say motion, poetry, and getting your people, maybe exercise is the wrong word, but it's just motion is better. Movement, turning off the TV, stop reading a little bit less, stop Googling your favorite TV show or whatever, and just Google Dr. Curnew and all these websites and stuff. And what I just get up and walk around during these things. I'm having some salad for dinner over here, and getting up and walking around. And so go ahead and do it. I was going to hope to go for a walk tonight, but so I'm hearing that 100 milligrams per deciliter is 5.7 millimoles. Is that right, Jerry?
I think it's I think me and Haley found around 5.5, 5.6. So if you see that you're above 5.5, 5.6, then you're all good to
Okay.
exercise.
Thanks so much. So yeah, there's the American units and there's international units. So basically, people who have diabetes should measure your blood sugar periodically and make sure you're in a safe range. So for instance, if you're a diabetic going driving, you want to make sure your blood sugar is above that mid-5 range. If you're exercising, we'll make sure that's good too as well. And you can learn to feel that too as well. It's always good to double check from time to time. Thank you so much. Go ahead there.
All right, thank you, Dr. Curnew. Yeah, so just to end off this slide, the recommended duration of exercise for type 2 diabetes patients, as stated by the American College of Sports Medicine and the American Diabetes Association, is 2.5 hours of moderate to vigorous physical activity a week, with aerobic exercises lasting at least 10 continuous minutes. So next slide, please. So optimal time for cardiovascular disease. So the duration of an exercise largely depends on the intensity of the workout, as mentioned. So majority of the benefit derived from physical activity is dependent on reaching maximum cardiac filling and getting your heart rate up. So the duration is adjusted for the time it takes to get to that peak performance. And the longer you maintain that state, the larger the benefits. So in a study by Matsuo et al., they studied the benefits of sprint interval training, which is when you do very short bursts of extreme intensity workouts. So they did 7 30-second bouts of extreme intensity workout where you really push yourself to the limit. Then high intensity interval training. So this is a little bit lower, but you're still getting your heart rate up, and that's 3 rounds of 3-minute exercises. And then moderate intensity continuous training. So this is, again, as we talked about, moderate intensity for 40 minutes. And so while the moderate intensity continuous training burned the most amount of calories, the high intensity interval training group saw the most benefit in terms of cardiovascular health. And so they saw the greatest increase in stroke volume, which is the volume of blood pumped out of your left ventricle, your left ventricular mass, and your peak VO2 volume. So this is the oxygen utilized during exercise. And so for high intensity interval training, you want to aim for 15 minutes of total workout time with duration of each exercise adjusted for the intensity. So the more intense it is, you can do shorter. So less than 1 minute, moderate is 1 to 3 minutes, and long is greater than 3 minutes. And so the particular study I looked at suggested the Norwegian model, which involves 4 rounds of exercise that last 4 minutes each with 3 minutes recovery time in between. And this gets your heart rate up to about 85, 95%. And if moderate intensity continuous training kind of fits more your lifestyle, more your needs and wants better, a general rule of thumb is that for every high intensity interval training session that you do, you want to perform about double the time with moderate intensity to achieve the same benefits. So you want to aim to reach around 60 to 70% of your max heart rate for around 30 to 60 minutes. And so because MICT is mainly aerobic exercises, it is recommended that you also incorporate some muscle strength training exercises as well. Next slide, please. And so optimal time by weight. So the duration of your exercise.
Just a point. So maximum heart rate, the best definition is 220 minus your age. So if you go back one there again, so you can see these, which we're trying to go these different sets of getting to 85, 75, 60%, whatever you want to. So remember, so if you're 20 years of age, so it'd be 220 minus 20, that'd be 200. 75% of that would be a heart rate of 150 beats per minute. So you can just adjust for yourself. And I think there's also what Haley was talking about, how you feel too as well. I better never sing. I can't sing, better not sing. I think I'll destroy the world if I sing. So if I can talk a few words here and there, then that's moderate, but I can't talk in a full sentence. Go ahead.
Yeah, thank you. Yeah, so definitely how you feel is a big indicator. So You can also kind of choose your optimal time by your weight. So as I was saying, basically, generally, the larger you are, the more calories you will burn per exercise because you're lifting more mass. So a chart with the approximate calories burned for a 154-pound person per exercise is kind of shown here right there. And so total calories burned can be calculated by multiplying the duration of your exercise by your MET, so your MET, so the energy expended times 3.5 times your mass divided by 200. So keep in mind that this is not an exact science, and there are millions of other factors to consider, such as your body composition, your oxygen intake, the temperature of your surrounding, the intensity of your exercises, and so much more. As stated in the previous slide, the amount of calories you burn does not necessarily correlate to the benefits you can receive from exercising. So this is just one of many approximation tools you can use to set different goals for yourself as your weight fluctuates. Yeah, that's all from me. Thank
So
you.
you just mentioned about METs. So can you expand what a MET is? Because when I do a stress test, I'll see how many METs someone's doing. So why don't you try to translate what a MET means to the average human being?
Yeah, so MET is when the amount of energy your body is using just from breathing, just from digesting, things like that, when you're standing absolutely still. And so when you're exercising, you can say, oh, I'm using around like, or if you get like 4 METs or something, you're using 4 times the amount of energy you'd be using when you're just normally at rest. So this kind of equation there just averages that to 3.5, saying your average exercise uses 3.5 times your resting kind of energy expenditure. But again, this varies for the type of exercise you're doing. So this is not an exact science, but yeah, it's just an approximation. Yeah.
So what I think about 1 MET is your basic metabolic rate. That's what you need to just sit here and watch. What I'm doing right now, getting up, moving around, is about 2 METs of work done. And to do your housework, to do simple shopping, do your chores, you need somewhere around 5 METs of activity. And to show that you're fit is somewhere between 9 to 12 METs. So if you can do more than 12 METs of activity, let's say on a stress test, it means that the chance of you dropping dead from heart disease over the next little while is pretty low. You have a quite good fitness level. If you go on a stress test and you just do 5 METs, that means you take all your energy that requires just to get up and shop, clean the house. Now, if you get sick and you're at bed rest for 2 weeks, you lose about 30%. They did this in healthy students. They took about 30 healthy students and just made them stay in bed for a couple weeks. It shows that your ability to exercise, your functional capacity was reduced by 30%. That's important. So if you can just do 5 METs on a regular basis and you get, let's say, pneumonia, you fall and break your hip, you're going to be down to 3 or 4 METs. It means you can't go home. Someone has to take care of you. You have to live with somebody. You might have to go to the nursing home. So to me, everybody should ask the question is, how many METs of activity can I do? And basically Lance Armstrong does 25, he cheats. But you should basically be hoping for over 7, 8, 9, 10, 12. Anything over 12 is really good. And and you can stride. Now, for every 1 MET increase in activity, mortality from heart disease falls by 10%. I'll repeat that. For every 1 MET increase in activity, this is based on observational data, so this is not the highest quality information, but pretty well collected, is you decrease mortality by 10, or cardiovascular mortality by 10%. So let's say you do 5 METs. You increase it to 8 METs, you just decreased your cardiovascular mortality by 30%. And you also give yourself, if you get sick, let's say you get COVID and you got sick, you got pneumonia, you had a heart attack, you have a hip operation, you now are safe to go home afterwards. So I think these are crucial numbers and very important. So everybody should know how many METs they should be able to do. And the best way we do that is by stress test. So and we actually, from a scientific point of view, 1 MET is 3.5 to 5 cc's per kilogram of oxygen uptake per minute. So there's a magic formula for that. You can actually measure a VO2 max. And we actually do that at the hospital from time to time, but more importantly, we can estimate that on a treadmill quite nicely too as well. So I think this is so important. And, you know, people, the best pair of shoes usually has a good pair of walking shoes that you don't fall. Maybe it's runners, maybe it's just a good pair of hiking shoes. Good walking shoes that you don't fall as much. This is so important. But thank you. So this is crucial. Thanks. Fire away. Keep going. Keep going.
Yeah. Okay. That's all for me.
Perfect. Thank you everyone for presenting. And lastly, I'm just going to talk a little bit about type. So type of exercise. So generally there are 2 types of exercises. So resistance exercise and aerobic exercise. And of course, there are other types as well. I'm just going to focus on these 2 today. So resistance exercise are exercises that challenges our muscles. So it targets muscle strength, muscle endurance, and muscle growth. So some examples include weight training, bodyweight exercises using resistance bands, and etc. And as well, we also have aerobic exercise. So this is exercise that challenges our cardiovascular system. So it targets our endurance and is basically our body's ability to deliver blood and oxygen to our cells. And some examples of aerobic exercise include running, jogging, swimming, and many other forms of exercise as well, like walking, or even just kind of dancing around in your home. So now let's talk a little bit about why these 2 types of exercise are important. So I'll start with resistance exercise. So what resistance exercise can really help with is to maintain our strength. So after age 30, we kind of peak at age 30, our muscles will start to degenerate naturally. So this is something called sarcopenia. So it's age-related muscle degeneration. So we kind of peak at 30, and then after that, our muscles start to degenerate. And when we reach age 60, this gets even worse. So after age 60, the rate that it starts to degenerate at gets even faster. So that's why it's so important to be able to do these exercises to help maintain our strength. So we want to, when we're young, do exercise to build up a lot of our muscle. And then after age 30, we want to do exercise, resistance exercise to help maintain what muscle we have. And maintaining our strength is very important to decrease your risk of frailty when you're older, reduce your risk of falls, and to help maintain your quality of life, right? To give you enough strength to be able to do these activities daily living to help keep your independence. And lastly, resistance exercise can also strengthen our bones and our joints. So I feel like some people might think that if you have osteoporosis or osteoarthritis, you shouldn't do these exercises, but it's actually really helpful. So if you are at risk for osteoporosis, osteoarthritis, or even have these conditions, then doing some resistance training, like resistance training under supervision from your doctor or for a personal trainer, can really help to re-strengthen your bones and help to prevent injuries to your joints as well. So now I want to talk a little bit about how.
Backtrack 1 slide here. So we're our peak performances in our 30s, and it's all downhill. Same thing from the immune system to everything else right there right now. And it takes a deeper dive at 60. It's going to happen. You can actually delay this. You're not going to. So this is actually very, very important. So many people say, I'm going to do this later. I'm going to get retired when I'm 65, 55, whatever it is. But that's time, it's already too late. You've already lost a lot of muscle mass. You already lost a lot of fitness, and you can't grow that back. You can decrease the decay about this, but you can't make yourself 60 back to 30 again. But you can increase things a little bit, but it's really preventing worsening over time. So I see a great urge for people and for young people to develop a higher VO2 max so they peak at a higher level. Now, a lot of VO2 max is genetically determined. I get it. But we can all get more fit and extract more oxygen from our energy cells called mitochondria that we have, and we can actually be better about this. So, and I see this every day. people say, I don't understand why I'm tired, I'm weak, I'm short of breath, I've been overweight all my life, I've been sedentary. Well, you're now 65, you haven't really looked after yourself all that well, and your body's decayed, and this is what's going to happen. So you got to prevent this from happening. The time you have symptoms, the time you're short of breath, it's really far advanced. And so this is so important. And, we're treating for things like osteoporosis, how much vitamin D or calcium you should get, how much vitamin E or exercise you should get is probably more important, especially with resistant exercising. So get out there in the morning, do something at different times of day. And again, one of the most effective therapies for osteoarthritis is properly done exercise. It's better than many pain medications. So I just think, this natural, holistic thing called activity, motion, movement, so important. It is a religion for some of us. It's a religion for me. I hope it becomes your religion right now. Go ahead there, Jerry.
And I want to bring up another point too, is that usually we're nowhere close our potential. So for our potential for VO2, potential for muscle. So even if you're 65, you can still do exercise and get better, get bigger, get stronger. So don't think, you're 65, it's too late. There's always time for you to get to your peak potential and to get stronger and to get more fit. All right, so now let's talk a little bit about resistance exercise and the heart. So there was a study that found that individuals who did resistance exercise 1 to 3 days per week, had a reduction of 40 to 70% in their risk of heart-related events. So things like heart disease, stroke, coronary artery disease. That's a really big number. So it kind of shows that resistance exercise is really important in addition to aerobic exercise as well. And some other ways resistance exercise can help the heart is it can help to decrease some of these comorbid conditions that come with heart disease. So these are conditions that present alongside of heart disease for most people. So resistance exercise can help regulate our metabolism, so prevent conditions like diabetes, it can help to decrease joint pain, it can stop sarcopenia or reduction in our muscle mass as we get older, and can also reduce our risk of falls and frailty as well. So these conditions many times will present with heart disease, and if we do resistance exercise, we can help to decrease the risk of those conditions as well. And there also is emerging evidence, like Hafsa said, that resistance exercise can also reduce blood pressure to the same degree as aerobic exercise as well. All right, so now let's kind of go on to the flip side and talk a little bit about aerobic exercise. So our team talked a lot about the benefits of aerobic exercise. I just kind of want to reiterate some of the benefits that they spoke about. So aerobic exercise can really benefit our physical and our mental health, can really improve our cardiovascular health and our cardiovascular fitness, which is really important. And aerobic exercise can also be used as a tool to fight against diabetes and metabolic dysfunction, which impacts a lot of Canadians right now. And as well, it can also target our mental, so it can help improve our stress response and help improve our mood as well. So there was a study that found that if you have low levels of cardiovascular fitness, so we have poor fitness, that's associated with a higher risk of mortality from many causes. And one study even found that if you have low fitness, the risk of death was greater than the risk of death from smoking. So that's really, really an important distinction to make, and it shows how important fitness is. And lastly, I just kind of want to talk about fitness because it's really a modifiable risk factor. So something you can change, right? So if there are many times you might have some genetics that can cause some things that you can't change, but our fitness is something that we can change. So we can get better, we can get stronger, and we can get more fit and reduce our risk for future events and improve our outcomes in the future as well. So kind of expanding on what the importance of aerobic exercise in the heart, what aerobic exercise can really do is to help keep our vessels healthy. So it can help decrease stiffness in our arteries and our vessels, increase compliance, and decrease inflammation as well. And these things are really important because stiff arteries, less compliant arteries, very inflamed arteries can increase plaque buildup and can lead to coronary artery disease, which we know can lead to things like heart attacks and stroke. So we want to do exercise to make sure our vessels can expand and to kind of get bigger and accommodate larger pressures so we can keep a healthy heart and healthy vessels. So something aerobic exercise can do is it can increase the availability of a hormone called nitric oxide. So this is a natural vasodilator in our body. So what it does is it naturally causes the expansion of our vessels. So by expanding our vessels, we can decrease our blood pressure, and we can also make sure that we don't get as much plaque buildup as well. So that's a big reason why exercise training is recommended for those of high blood pressure, those of hypertension as well.
It's interesting that if you go back one time, is that nitroglycerin gives you nitric oxide. So it's a vasodilator, opens up the vessels. So when you get chest pains, what you do is you take sublingual nec, you take a nitro into your tongue, you wait 3 to 5 minutes, and if pain doesn't go away, you take a second, a third, and after 15 minutes, if you have chest discomfort, it doesn't go away, you should call 911 if you think symptoms of the heart and go to the hospital. Provided you're not taking like a Viagra like medication, because the Viagra and nitro don't mix. But basically, you can use nitro naturally. The natural approach is exercise, and that gives you nitric oxide. So it's just and you need a healthy vessel to generate nitric oxide. So so this just shows you the link between exercise, plaque buildup, and activity. One of the things that you mentioned, things like, fitness and things of that nature. One of the things is we lost a lot of fitness during COVID. I lost some. I didn't realize how much I lost. I was really smart. I thought I was going to lose weight. I did all those right things, but I didn't exercise as much. So when I got back on the squash court, all the people I played, you're weak, you're weak. When they got back quicker, I was afraid to get back into squash truly because of worrying about being around too many people. So I learned is that if you go, for instance, bariatric surgery to lose weight, which is a wonderful thing, you lose a pound of fat, you also lose a half a pound of muscle. If you use Ozempic for losing weight, you lose a pound of fat, you lose a third of a pound of muscle. So in order to decrease the loss of muscle mass, which is key to your survival, is that you have to form some sort of activity motion in this. Without this is that, you're doomed to a bad life at the end. You showed us that 30, your peak performance, 60, it really starts to take another big hit. So if you haven't done activity, yes, you can build some of that back up. But if you don't add much activity, when you get to the golden years, they're not so golden anymore. And my golden years, I'm not quite there yet, but I'm in my early 60s. I hope to be golden because activity is one component of that. Now, one of the things is I treat people with congestive heart failure. And I think for many of us, it's going to be the leading causes how we're going to die, is that what happens is that the heart gets stiff, fibrotic, it gets a blood pressure because of weight, because of activity, because of diabetes. And so the best solution to this is exercise. Something called a Kansas City questionnaire that just tells you your quality of life. The medications may make you live longer, but your quality of life may not be as good as you want, where activity improves your quality of life the most. So the best way to treat, I think, quality of life is activity. I'm so sorry to harp about this, is that but it is such a key factor. And thank you for bringing this up here. And my prayer, my wish, my desire for everybody is, as Jerry tells me, going from nothing to something is the greatest benefit of exercise. Whether it's 2 minutes, 5 minutes, 30 minutes, 5 minutes here, 10 minutes there, just start and move forwards. And again, before going to bed, for better sleep, put on one of our webinars and we'll put you to sleep. So start the day with a little bit of activity, be sensible diet, and end the day with a little webinar and fall asleep. Go ahead.
Yes, thank you, Dr. Curnew. So I think you probably had a lot of motivation now to maybe be a little bit active. So I want to talk a little bit about self-monitoring. So something I wish you'd be able to pick up on, in addition to being more active, just tracking your physical activity. So self-monitoring is, like what I said before, tracking your physical activity, whether that's on paper or with a device. And we're basically tracking the FITT principles, what we talked about today. So frequency, how many times per week did you exercise, intensity, how intense your sessions were, time, how long your exercise took, and the type, so what you were doing. Were you walking, were you running, were you doing some weights? So self-monitoring can be really important because it allows you to track your history. So by writing down what you've been doing over the past week, over the past month, you can visually see your progress and also look for areas of improvement. So able to see that maybe this week you were able to do all 7 days of activity, or you've been able to, over the past weeks, you've been able to go up 10 minutes per week of physical activity. And seeing that progress can be really powerful and can be a great motivation tool by showing you that what you were able to do and that you're able to live a healthy lifestyle. And as well, you can also maybe look for some areas of improvement. So maybe some days you weren't as active, you can kind of reflect and think about why that was the case. Maybe you were working a lot that day, maybe you were burnt out, overwork, and how you can figure out ways to kind of supplant that and to make sure that doesn't happen again. And self-monitoring can also be a good way to keep yourself accountable, because if you know you're going to be tracking what you're doing, then you're probably going to be doing a lot more. So if you know you're going to be writing down your exercise for the next week, then you probably might do 1 or 2 more exercise sessions, right? So number at the end seems a little bit better for you. So it's a great way to give you motivation and a great way to keep yourself accountable as well. And lastly, self-monitoring can be combined with many, many other tools. So whether that be with goal setting, creating action plans, identifying your patterns, right? It's a great kind of starter and a great foundation to kind of jump off and do other things as well that can help improve your motivation. So if you do want to start some physical activity tracking and you prefer to use paper, then you can scroll down to the link below in the description of our YouTube live stream, and you'll find a link to this physical activity tracker here. And basically it's just something you can print off at home, or you can kind of fill out on your computer as well. And it has an area for the dates that you did the exercise, what you did, so the time and intensity. So here you can put things like RPE, you can use the talk test that Haley talked about before, and some comments. So if you can maybe write down what you felt during or after exercise or any comments you have, and just have this tracker with you, kind of write down what you were doing and maybe do it for a week or a month and see how it goes. So if you're interested in using paper version, you can scroll down below and you can find this in the description. And once you've kind of written down all your physical activity, you've been tracking your progress, something else that I really want to ask you to do is to consciously review that progress. So writing down is very helpful, but also sitting down and kind of processing what you've written down is also very important as well. So take some time, whether that's every day, every week, or every month, just kind of look back at what you're able to do and pick out those really small successes. So doing 5 extra minutes of activity, going from low to moderate intensity exercise one day, and really celebrate those small successes and savor those accomplishments, because that can really help to boost your motivation, boost your confidence and self-efficacy, right? And show you that you're able to live a healthy lifestyle. And as well, when reviewing your activity, also look for some patterns in activity. So whether that means you're less active on a certain day, so maybe you're less active on work days, then you can kind of think about ways you can plan around this. So maybe you're going to do exercise, first thing in the morning. So when you get back from work, you're not too tired. Or maybe you're going to schedule more exercise on the weekends and do more then versus on the weekdays. So you can kind of look for different patterns and figure out ways to go around them. As well, you might be seeing that you're less active after specific commitments or activities. So maybe after kind of watching your grandkids, you feel too tired to exercise, then maybe you can do some activity with your grandkids, like some dancing or some walking, and kind of take advantage of that time as well. So I really want you guys to kind of pick a time frame to review your progress, whether that's every day, every week, every month. Just pick that time and kind of sit down and review what you see. That can be really helpful for your motivation. All right, and I just want to end off today talking about device tracking. So now we have a lot of different apps, a lot of different devices you can use to track your activity. You don't have to go traditional pen and paper. So if you do have a smartphone, then there are 2 great apps you can use to track your activity. So if you have an Apple phone, you can use Apple Health. So this is installed by default on your phone. So if you can search up Apple Health on your phone right now and you'll be able to see it. And this can really help to track things like your sleep, your activity. If you have an Apple Watch, you can also connect that as well, and you can get some more information off that. And you have an Android phone, you can go and download Google Fit. So go on to Google Play Store, type in Google Fit, and you'll be able to download this app. And it's pretty much the same thing as Apple Health. You'll be able to track things like your sleep, your activity, your calories burned, that sort of thing as well. And an app that I really want to point out is called ParticipACTION. So this was created in conjunction with many researchers in Canada, so Queen's University, as well as Public Health of Canada and CSEP, so Canadian Society of Exercise Physiology. They created this kind of community outreach program called ParticipACTION. So really getting Canadians to move a lot more. And with that program, they created this free app. So this app, if you search up ParticipACTION, you'll be able to download it. And something that's really good about this app is it already connects to some default apps that you have. So for Apple Health and Google Fit, it can take that information directly and pull it onto its app. And something I really like about it as well is you can also add in activity. So maybe you went on a run, but you didn't have your phone on you. Because I know when I go on run, I hate having my phone on me because it's kind of big, it's clunky. When you're running, kind of always hits on your leg, so it's not really that comfortable. You can add in the activity later on. So you did 30 minutes of running, you can add that in and it'll count it towards your goal as well. So we're able to track things like your steps, your move minutes, your active minutes. So your active minutes is time that you spend doing moderate to vigorous intensity exercise. You can also set goals as well. So for example, if you set a goal of 150 minutes, you can see throughout the week if you're reaching that goal as well. It's a really great app to be able to kind of track your activity throughout the week. If you don't like to use pen and paper, this app can make it a lot easier for you. And something else I really like about this app is, in addition to the exercise tracking, you're able to kind of get a lot more motivation things as well. So they have automatic weekly, monthly, and quarterly draws for prizes. So you can win Sport Check gift cards, Amazon gift cards just from being active and using the app. And as well, something that we did in our motivation, mindfulness, and moving group on Wednesday was the volunteers and Dr. Curnew and some of our patients who create this group on ParticipACTION. And we did a challenge in December called the Great Big Move. So basically they took the distance of Canada and turned it into minutes. And throughout the month, we wanted to kind of add up all our minutes so we can go across Canada. So you can see here on the right here, as a group in December, we did 13,116 active minutes or move minutes throughout the month of December. So that was awesome. And we had a nice little leaderboard here. So if you do have friends and family you want to compete with, kind of want to make it more like a game, if that helps you with your motivation, then ParticipACTION is a great way to kind of connect with others and kind of use that for motivation as well. And lastly, they do have access to different tips, blogs, and exercise videos on the app as well. So if you're interested in trying something new like HIIT training or yoga, you can find some videos on the app to help you get started as well. All right, so thank you all for listening today, and I hope you took away the importance of exercise and exercise tracking. And as well, if you want to connect with us, you can always email Dr. Curnew at the email here, drcurnew232. You can also look at YouTube as well, Dr. Curnew, for more videos like this and other videos on health as well. Thank you so much.
Fantastic. This is probably, for many people, the most underused pill magic. Jerry, what percentage of Canadians are active again?
I think the newer number, I think, is about 30 to 40% are active.
So we're getting better. So it's interesting. I remember we did that. So I'm not great as apps as some of these young people, so I couldn't get my thing to work properly. So we should do it again. I'm going to get Jerry to install that properly onto that. It's kind of funny. I got myself a new phone, and only half the stuff got transferred from the old phone. It should transfer with ease. So as you get older, computer skills go down too as well. I guess your fitness goes down, start at the age of 30, and then I guess your computer skills go down too as well. I don't know, or I never had them properly, but I'll keep working at it. But one of the ones I really like Fitbit. I've been using Fitbit for a number of years. It's this thing on my watch, does different things, and it really makes me, right now, if I got this right here, I was just looking at this a little bit here, is that it measures my sleep, and so my sleep is gone up to averaging 5 hours and 30 minutes a night, and this is actually quite good for me. I used to be at 4 hours and change, so I'm trying to get to my magic number for me is towards 6. My steps over the last year, let me just take a look at that here, which is kind of nice, is that it's a good thing. So since the start of this year, I'm averaging 10,567. My goal is 12,000. I used to do 12,000. And the other thing too is, calories spent. That's the thing that really I want to be able to eat more. And so I'm eating about 3,000 calories a day. I can eat 3,000 calories to keep my weight where it is. So again, if you're sedentary, then you're going to be about 1,200 calories a day, and so that's why that activity. And today so far hasn't been a good day. I've only up to about 5,000 steps, but I think after I finish my call, I'm either going to do the stairs or maybe walk down to the harbor today and go for a walk around there. I'm going to play squash tomorrow morning at 6:30 in the morning time, that is. And so please think about how activity incorporates. I work a lot of hours, but I make activity a religion, and it is so vital to my well-being and to your well-being as well. And I feel so bad to see so many people no longer can look after themselves. They get frail, they fall, they're in pain. I can't lose weight, I don't eat anything, and their lives aren't very good. So you can make your life better. Activity is a key ingredient to this. So thank you all for sharing that. Stuart, what are some of your thoughts?
Yeah, so like you said, most people will probably say that they want to exercise, that they want to work out, but the hardest part is getting started, and then once they get started, doing it consistently and making it a part of their daily routine or weekly routine. I'm certainly no stranger to that struggle. What I really liked about the group's presentation today was they talked about a number of different things. Jerry touched upon the different types of exercises. I know Haley touched upon some different things when in regard to intensity. We also talked about frequency of exercises. And while there was a lot of information covered, I think the main takeaway for any audience member who joined us today or who will be watching this is just to try and take measurable small steps greater than what you're currently doing. Trying to do a little bit more based on what you're doing, whatever your baseline is, wherever you're starting from, just trying to start off small and doing a little bit more starting now and continue to build from there. It's not always going to be an uphill trajectory. Seasonal, a lot of people will struggle in the winter because they can't go outside, for example, and that becomes a difficult period to exercise. COVID was, of course, a factor for many people, not wanting to go outside, not having that social connections that maybe you were so used to prior to. Whatever, other factors as well. There's so many different things that can come into play. And it's important to recognize that you're going to fall off the horse a lot of times, but you got to try and find ways to get back on it. So what the group really wanted to do today was to just give you some ideas, sprout some ideas in your mind as to how you can start doing a little bit more than what you're currently doing and keep on building from there. The last thing I'll say as well is the team shared a number of wonderful links and resources as well. All of those are included in the description of these videos, so they're easy to check out and access. And if you ever have any questions about how to access them, you can always speak to one of us, whether sending us an email that you see on the screen or just connecting with any one of us while you're in the clinic at your next appointment. We'll be certainly there to help you out when it comes to how to access some of these resources or even just how to use YouTube and watch other videos in our series. With that, there's no real questions in the chat at the moment. It seems like everything was well answered. It seems like all people's questions were answered based on what they discussed, but I'll pass it back to you, Dr. Curnew, if you had anything else you wanted to add. Just like the last time, I think Dr. Curnew's connection is is going by the wayside right as we're wrapping up. I'll give him another moment just to see if he's able to rejoin us. But in the meantime, Jerry, was there anything that maybe you wanted to discuss before we pass over to Dr. Curnew?
Yeah, I think you touched on kind of everything that we wanted kind of the audience to pick up on today. And I think last, I just want to reiterate how important I think self-monitoring really is. So if you are thinking about getting more active, just take that time after your workout, just kind of write down what you did. And I think that's a great way to be able to build that motivation and to give you those reminders that you're able to be active, which I think is very, very powerful to keep you going. So if you do if there's one thing I want you to pick up on today is, self-monitor, track your exercise, and I think it'll be really helpful for you in the future.
Does anybody else have any final comments? And I want to just give a plug to Jerry and his team for the mindfulness, motion, and motivation group that meets on Wednesdays at 7 o'clock. We'd love to spend an hour with you once a week or so. It really is a very special place. These young people it's taught me a lot, and I hope you take advantage of that. And all these young people are really our future, and they've done a great job. So we, as the old farts, have probably ruined the planet and ruined the world, and we need to make this world a little bit better. And activity is one way of doing that. Maybe part of the reason we become more unfriendly over the last few years is that we've been isolated and we haven't been active. We lost that. So I'm certainly working hard, trying to be nicer, more active, skinnier, eat better, think about the planet, think about others a little bit more. And activity fits in so nicely with that. And don't be hard on yourself. Some days you're good and some days you don't. That's okay. Tomorrow's a new day. I guess we'll say good night unless anybody has any comments. I want to just thank everybody. Well done, everybody. Good night.
All right. Good night, everyone.